So let us begin with Ellen's keynotes study streak. In fact, let us continue because we have been doing it since the 11th of June, and there are around 50-60 remedies which are still left. And yesterday we discussed about Agnus casters, and I told that many of the patients that we see, especially who suffer from sexual dysfunction, they require a series of remedies. So glad to see Dr. Amruta Pore, Dr. Abhishek Singh, Dr. Jagruti Soni, and Dr. Anshu Dubey. And on YouTube, I can't see the viewer names, but there are plenty. So the patients who have sexual dysfunction require a series of remedies. Many times you will just be giving one remedy to them, but at times they may not get cured because they would require a series of remedies. And if you know what is the series of remedies in a proper sequence, it will get them back on track much faster than you normally expect one remedy to do. Sometimes it's one remedy, it can be like 30% of the cases, but 70% of the cases, especially in sexual dysfunction, it will be a series of remedies. The constitutional and the local remedy, the constitutional and the local remedy, it goes hand in hand. So today we'll discuss Caladium and Selenium after discussing Agnus casters yesterday. In Caladium, we see the first line that is mentioned, the very first line, and I have been laying emphasis on very first lines mentioned in Allen's keynotes, in Boric, everywhere. And the first line mentioned is very sensitive to noise. Slightest noise startles up from the sleep, startles up the Caladium patient from sleep. Now, when you understand this aspect of Caladium, life will become much easier for you to prescribe Caladium in other patients. For example, Caladium is hypersensitive on the gastrointestinal system. Caladium is hypersensitive in the sexual sphere. He is so sensitive that there is, complete absence or immediate, uh, desire to, get those feelings for sexual desire. That is the sensitivity of Caladium. So if the sensitivity to noise is there, it is there on the mental level, but on the physical levels, the problems that Caladium faces are also similarly present. You will see it to be prescribed in cases of sexual dysfunction and in cases of skin troubles. Very ignored remedy, but very useful. So for very sensitive to noise or startles from sleep, we have Asarum europeum, Nux vomica and Tarantula, which is very similar to Caladium. Sweet sweat attracts the fly. We saw this also in Thuja, and lot of these psychotic remedies and especially the sexual remedies will have sweat, and this will be more or less too good or too bad. Whether it attracts flies, this is a very out of context symptom. Many patients will not tell, and no one will be naked for so long that it will attract flies. But this is a symptom which must probably be seen in cases who are bedridden and the sweating is there. That is why it is expressed in this way. Next you have is aversion to motion. Patient dreads to move. We saw this very strongly in bryonia, and Caladium is a very good remedy which destroys the craving for tobacco. There are a lot of remedies which will give this relief to patients who have craving for tobacco. Like for example, few days ago we discussed a remedy which is coca. This is also one of the remedies. Caladium and coca are top remedies to destroy tobacco craving. Or patients who are getting de-addicted from tobacco, they have issues, you can give them these remedies and it will help them. Most of these are low socioeconomic people who need to take these drugs induced feelings. These tobacco which induces drug like feelings or gives them a sense of alertness. That is what need to be understood, and prescribed Caladium, coca naksomika according to their nature and their expression in their life. Next you have for gastrointestinal system, caladium. Eructations are frequent of little wind as if stomach were full of dry food. Now this will be expressed few times by patients. If it is not present, you have many other things to prescribe. For example, in the male sexual system, you see there is impotence with mental depression. Patient will tell you that I am feeling sad because of my performance related issues, and please give me some medicines because there is a good desire but I really cannot bring the power back. That is what caladium will do for them. It will give them the good feelings and good strength as well. Relaxed penis with sexual desire and excitement. We have the similar phenomena present in lyco and selenium as well. No erections even after caress, no emissions, no orgasm during an embrace. Calcarea carb and selenium are very closely related to caladium in this aspect. In female reproductive system, we have pruritus vaginae induces onanism. Origanum and zincum are very closely related during pregnancy with mucus discharge. So you have caladium acting very well on the male and the female reproductive system, and the patients will exhibit these symptoms more or less. If they will tell just one symptom, you can probe it further to classify them into agnus, caladium, selenium, lyco, calcarea carb, and these remedies which are more or less acting on the sexual sphere as well. The remedies agnus, selenium, caladium will mostly be more or less specific organ related remedies, and you can intersperse these remedies with the deeper polycrest remedies which is going to help in aiding the cure for the patient. In the caladium for the fever, Allen mentions that falls asleep during evening fever and wakes when it stops. Giving caladium for fever I have never encountered, but there are many other cases where I have given other remedies which I will be discussing in the fever workshop. If you plan to join, there are good chances that you will learn a lot more than what you already know about fevers. In the skin symptoms, you have mosquito and insect bites that burn and itch intensely for caladium. Although in the skin symptoms, very less symptoms are mentioned. When you go and see that there is itching in the groins, there are eruptions or macular rashes or kind of irritation in the groin region due to the jock itch and tinea cruris phenomena which we commonly encounter in practice. You should give them caladium. It will mostly try to make it soothing for the patient to overcome it, and then you can follow it up with a constitutional or a deeper medicine. It can be antisoric or antisyphilitic or antipsychotic also. Other aspect what I have seen is that if there are eruptions in the uh, groins and the natal region and the buttocks region and lot of itching, clematis and merc sol will help them more often. So that's what caladium is all about. We'll proceed to the next remedy which is very closely related to caladium, and that is selenium. Adapted to light complexion, blondes great emaciation of the face, hands, legs and feet or the single parts. So you will see that there are single parts that kind of are wasted due to non-usage or due to some disease or due to the constitutional deformity which the patient has. Those cases will require selenium. Very forgetful in business, during sleep dreams of what he had forgotten. Hungry at night. Now we see this symptom very strongly present in sorinum. You have to think about sorinum whenever the patient tells you about this symptom, but do not forget about all the other remedies, especially Sina and selenium also. If it's a case of an adult male who is around in his 30s and 40s, he has more longing for spirituous liquors. They will be alcoholic, they will ask for alcoholic drinks mostly in the midnight, and almost irresistible maniacal desire. Those patients who cannot wean off from alcohol If you're giving them nux vomica, think, give a second thought, think about selenium also. This is going to help them mostly because the time that they will have this desire is mostly at the midnight. Weak, easily exhausted from either mental or physical labor after typhoid, typhus, or debauchery. So after taking alcoholic drinks, after any illicit things that they shouldn't do, or after a disease, if the energy is not returning back, selenium will set it all right. If there is lot of hair fall after infectious diseases, thallium should help. Irresistible desire to lie down and sleep, strength suddenly leaves him, especially hot weather. So when you see this remedy, selenium, in the periodic table, it is somewhere in the fifth or the sixth row, and it is present in those area where on the right hand side of the periodic table, where the strength of the mineral remedies, the other remedies around it, are starting to collapse, and that is why you will see that it is a remedy which can be given in some patients, in such patients who have depletion of their energy due to some acute illness or chronic illnesses. It is also a remedy which is hypersensitive, like there is very great aversion to draft of either of air. It can be warm or cold or damp, and there is emaciation of affected parts. So you will see that the patient is affected in the legs. There are lot of plenty of leg pains, and there is the strength of the leg is not so evident. The patient is kind of weak, and there is lot of muscle wasting. It can be seen in old debilitated cases where they are not moving enough and they are just bedridden. You will see that there is headache of people who are chronic alcoholics. We saw that in the few symptoms earlier also, that they have strong desire to have alcoholic drinks, and if there is after taking any lemonade, wine, tea, or it happens periodically every afternoon, think of selenium very strongly. The hair in selenium patients where falls off very soon from the head, from the eyebrows, from the whiskers, from the genitals, all the other parts. This will be a confirmatory symptom more than the patient telling you from his own side. In the respiratory system, we see that there is aphonia, very rarely a metal which is on the right side of the periodic table sharing this symptom, but it will be mostly be seen in singers who after long usage of voice, there is huskiness which begins to develop when they start to sing, and they are obliged to clear the throat. This is called as hawking or hawk disposition 2, which is very strongly seen in argentum metallicum and sternum met. We should give a thought to selenium also if you want to cure them, if you want to give them a good result. You will see that there is tubercular laryngitis which develops, and selenium will act more evidently in such cases. If patients develop coryza, but the coryza stops and then the diarrhea results, you should think of selenium. If it is the opposite, you can think of sanguinaria as well. In the gastrointestinal system, you see that there is constipation, large stool, hard, which requires mechanical aid, and aloes, calcarea cup, sanicula, sepia, silica. We've already studied many of these remedies. They have these symptoms where the constipation is mechanically removed, and they will require, maybe give a thought to selenium also, it can help. So it will be different components. I have already shared how different components need to be brought together. It will be a patient who is about 30-45 years of age, who takes alcohol on a regular basis. He has headache every day, and he has a husky voice, and he has constipation. Those are just the presenting symptoms. Different components present in Allen's keynotes in different areas. Bring them together and prescribe selenium. That is what you should. That is how you should use LM keynotes in clinical practice, and you will see that in selenium there is urine which is red, dark, scanty, coarse, red, sandy, sediment, and involuntary dribbling of urine when walking. After typhoid, there are a lot of symptoms in selenium, and one symptom that you will see is that there is lot of weakness, especially of the back. Pains will be there, or he fears that there will be paralysis. In the male sexual sphere, you will see that there is impotence, for which we are specially covering this remedy with Caladium and Agnus castus, because this is the area which is the key presenting symptom for selenium. You will see that there is impotence with desire, lot of good desire, but lot of weakness in the sexual sphere. They will have bad thoughts, bad dreams, and they will be physically not competent enough to perform well. You will see that there is a mention for sudden impotence for chlorellum hydratum, which is very surprising. In patients who are starting to develop sexual dysfunction, they will tell you that so far things were good, but nowadays I am seeing that the erections are very slow, insufficient, and there is immediate emission of the semen. Those will require selenium. They are very much irritable, like a nux vomica. You will give them nux vomica, but maybe nux vomica will just palliate them, not heal them, not cure them. Selenium is the best remedy in such cases where there is lot of semen, prostatic fluid, which kind of oozes throughout the day, and this is because of the incompetent valves and the weakness of the sexual sphere, which selenium will cover more better than the other remedies. You will also see selenium very useful in priapism, and the glands are drawn up, and if the glands are drawn down, the remedy is cantheris. For modalities, we see that there is draft of air which aggravates selenium patients. You will see this very strongly in nux vomica. So this is a remedy which, if you're giving nux vomica to all the patients who are alcoholic, who are chilly, think of selenium also. This is going to help them. They have aggravation from the sun, from lemonade, from tea or wine, and amelioration from taking cold water or cold air into the mouth, which is very interesting observation which you need to pick up. You can see selenium very strongly in comparison with phosphorus in genitourinary sphere, respiratory sphere. In fact, I would correct myself and tell you that phosphorus and selenium are very close in all the spheres, and argentum metallicum and stannum can be compared with selenium in genitourinary and respiratory symptoms. And in argentum metallicum and stannum, you can also see there is laryngitis of singers and speakers, which is also there in selenium. If there is hard stool or inactive rectum, think about alumina also. And if you have given selenium, or if you are thinking of any other remedies like caladium, natronamyl, staph, phosphoric acid, think of selenium also, and that would probably help you cure them more often than palliating them with other medicines. If you are thinking, more importantly, if you are thinking of a chilly nux vomica patient who is chronic alcoholic, think of selenium, give a thought to it, try to match the symptoms. They would probably be hungry at night, and that will be helped by selenium more than nux vomica. So that brings us to the end of today's session, and we discussed two remedies. One is caladium and another is selenium, and we'll continue with Alan's keynote study streak again tomorrow evening with the remaining remedies, and we'll learn something little bit, and you can read along to get yourself equipped with a lot of clinical tips, and also what is the academic knowledge you are going through. That's what we come to an end for today's session. And if anyone wishes to, thank you Dr. Sailesh Kumar for your comments on YouTube, and if you have any questions related to fever, today evening I'll be doing a session for 10 minutes at 9:30 p.m. IST. Join and ask your questions related to fever, and maybe you will get some ideas on how to treat fevers. If you wish to join the workshop, the fever workshop, which begins on 15th August, you have all the details. You can find all the details and join the workshop as well.